Thank you for joining today's webinar entitled HIV Self-Testing Promotions with Greater Than AIDS, a Delaware Case Study. My name is Kayla Coleman. I am a marketing manager for OraSure Technologies, and I will be your moderator today. In order to cut down on background noise, we have automatically muted everyone's microphone, but we do have the Q&A tool set up to receive questions. This feature can be found at the bottom of the webinar screen. We will use the second part of the webinar as a live Q&A session. Please submit your questions through the feature and I will read them out to our panelists. We will try to answer all questions during the webinar, but if we cannot get to your question, we will follow up with you directly after today's session. We also have contact details throughout the webinar in case you experience any issues or are unable to submit your questions. The recent resurgence of COVID-19 continues to cause challenges for HIV prevention and treatment measures. Testing numbers continue to be below average. In order to reach the goal of ending the HIV epidemic, it is paramount we find innovative solutions to screen, prevent, and treat HIV during the pandemic. Our team remains devoted to you, our communities, and the fight against HIV. We are here to help identify and set up innovative ways to continue or start screening programs all throughout COVID-19. During this week's edition of our Testing Thursdays webinar, we wanted to highlight a great organization that not only shares our devotion, but also offers a range of services and expertise for you to leverage during this difficult time. Next slide, please. Our first guest today is Robbyn Kistler. Ms. Kistler has worked with Kaiser Family Foundation on global and domestic media partnerships since 2007. She is a liaison between the U.S. state and local health departments for Greater Than AIDS, working collaboratively to enhance jurisdictional social marketing efforts through coordinated media placements and community outreach. She is a graduate of Oberlin College and serves on the board of He is Valuable, Inc., an Atlanta-based organization dedicated to celebrating and supporting Black queer men. Robbyn, thank you so much for joining us today. And with that, I hand things over to you.
Thank you so much, Kayla, and thank you to your whole team at OraSure that put this webinar together. I am delighted to be with you all. I wish I could see your beaming faces. It's definitely one of the detriments of COVID, among many. But we're here today to talk about some solutions for this time, and I really hope that what we've prepared will be practical and useful and helpful for all of you, and really appreciate that you've chosen to spend your time with us today. This is really a special time to be engaged in public health, and there are so many demands and so much is shifting our normal ways of doing things. We are just really grateful that OraSure created this platform for all of us to exchange ideas and learn from one another. So I'm really looking forward to the conversation. A little more about me. As Kayla explained, I work as a liaison between health departments and other partners for our Greater Than AIDS initiative at KFF. I'm actually a Pennsylvania farm girl who wound up living in Brooklyn for the last 17 years. I don't really know how that happened, but I still kind of feel like I grew up on the farm, and that's where I really belong. Since you can't see me though, maybe just picture one of the stoops in Sesame Street and you'll have the picture of where I am now. I suspect that some of you are already actively partnering with us and we already work together. So if you know me, you probably know that I'm a hugger, and I'm offering every one of you a virtual hug, whether we know each other or not. I've missed those so much during this time of less in-person connection, and I know we all could use some love. So the best speaker today will be Sal Seeley, my colleague and partner, who's joined for the second half of this conversation. And my job is to get out of his way as quickly as possible. I promise he'll steal the show. And since I could go on for hours about Greater Than AIDS, I'll move my part as quickly as possible so we have plenty of time with him. I'm going to give you a quick overview of KFF, provide some background about Greater Than AIDS and how we work with health department and community partners to promote HIV services. We'll talk through pretty briefly our national community partnership with Walgreens, OraSure, and others. And then we'll get to the case study of our self-test promotions with Delaware. So bear with me for about 20 minutes and then you'll get to Sal. Introducing KFF, the Kaiser Family Foundation. For those of you who may not be familiar, we are a nonprofit not grant-making foundation. We run our own programs. And folks often think we're Kaiser Permanente when they hear our name. So to be clear, that is also not us. We aren't providing medical care. Our service is actually trusted information about health issues in the United States. We've worked on HIV for decades, and in 2009 founded Greater Than AIDS to increase knowledge, reduce stigma, and promote actions to stem the spread of HIV in the US. If you think about those pieces, increasing knowledge, we have so far still to go. There's still so many myths and misinformation. Reducing stigma, every conversation we have about what it will take to end HIV, stigma are the roots. And promoting actions, there's so much each of us can do to educate ourselves, to get tested, to choose PrEP or treatment options. Long way to go, and we've come a long way since we started. We are a national campaign. Everything we make is for you, meaning our messages are intended to connect people to the services you are providing. So through our public-private partnership, you set up the clinics and testers, and we make messages to promote those services. And then the way we all come together using every medium we have to get the word out, whether it's Facebook or radio waves or handing out flyers, maybe not handing like quite so directly these days, but hanging them somewhere that they can be seen visibly. We really mean it when we say together we are greater than AIDS, you are the we collectively. We're not a media company. Our goal is just to spread information faster than the disease. So let's take a look at some of the ways that we can partner. I wanted to launch with talking about health departments, not only because it's my role at KFF, but also because health departments we really see as a core part of our strategy. If you're sitting in a health department, you know that you are sitting on the majority of the resources this country has to respond to the epidemic, and you're central to connecting us with all of the other agencies that are funded for testing and other HIV services in the state. Health departments help guide us in understanding the needs on the ground. And that's a really important feedback loop for us to stay fresh and in the moment. That's actually how our focus on self-testing came about this year. In March, as COVID was coming and we were tracking, really eagerly listening for every morsel of information from states gathering together with prevention partners and care services folks. Where are we with HIV and how is this affecting access to prevention and treatment services? It became clear very quickly that testing was dropping rapidly. We've worked in the past with Virginia on their test by mail program and with Emory University on their PrEP labs at home. So we had some familiarity with the option of mailing tests, in addition, obviously, to the opportunity to purchase a test at a local pharmacy. And it became clear that this by mail piece was going to be more important than ever during this time. Before we completely dive into self-testing, I do just want to take a moment to explain that in addition to testing, we look at HIV from sort of a 360-degree lens. Talking through the pillars of EHE, that means the diagnose piece, the PrEP and other prevention tools piece, treatment access, and really amplifying voices of people living with HIV, using information and storytelling to reduce stigma associated with the disease. So this 360 idea, someone may realize they're at risk for HIV and decide to get tested or be offered to be tested by a health provider and opt in. But often folks don't know that they're at risk and are not offered. So they may come to testing from another route. It may be that PrEP is a new idea for this person and they're interested, and so they talk to their provider about it. And of course, how does PrEP start? It starts with a test to confirm your status. Similarly, someone who is living with HIV and maybe on treatment might be interested in PrEP for a partner. And again, it's sort of this loop around, and obviously treatment also begins with a test as well. So we see the pieces as intersecting and important to understand and build knowledge about all of the aspects. I do, just before I move on, want to point out some of the ways that we've localized the ads. If you look as examples of working with Texas, Georgia, New Orleans, through the Louisiana Department of Health and the state of Virginia, we create a custom URL to make sure that we're directing folks in your location to resources that are germane to appropriate for them. So that's one way that we do it. In Virginia, we were looking at promoting the various ways that they've created to access testing, in addition to the typical doctor's offices and public health centers. They are working with Walgreens for pharmacists to provide testing and also have this at-home kit. So this is a program that we've worked on for several years with them, and it's part of the core of the intersections of the self-testing. So just a few ways, examples. These are mostly billboard and transit ads. There's a Facebook ad in the middle. We work across all media, and we're not a media agency. We're a nonprofit. We have no need to make any kind of bottom line. We're just interested in getting information out to your audiences to connect them to your services. So if you're interested in broader social marketing about any topics beyond self-testing, we can certainly speak about those another time. Another resource that we've built in partnership with many of you and offer ongoing is on our website. We have several hundred videos that are stories about folks, in this case, telling of their testing experiences. These are all available to you. You can watch them at the greaterthan.org/stories. There's a filter on there. You could choose the testing stories, or if you're interested in other aspects, obviously there are other video topics there as well. And you can embed them in your websites. It's a cheap, cost you nothing. You can just put the link into the website and suddenly you've got this beautifully polished video that's been edited very carefully to educate and destigmatize and drive action around HIV. They're great for initiating conversations with clients or in any other way you want to use them. Get creative on social media, etc. Also on our website are graphics that are downloadable. They're primarily designed for social media and digital use, again, websites and Facebook, Instagram, Twitter accounts, but they also can be printed. I love the idea. I'm like a cheap and easy, like get it done kind of girl. So, printing the image, slapping it up in the bathroom stalls at whatever locations where there's going to be eyeballs in your public health clinic. Used to be in the bars, in dorms, if folks are going back to their dorms, wherever you can get eyeballs to sort of add to your message. And you can always add a testing date, event, build it out and put your own logo on, make it yours. Okay, moving on to the National HIV Community Partnership. This is a collaboration we've been growing since 2011 with Walgreens. OraSure has been a partner since the very beginning, along with some other diagnostic companies and hundreds of health departments and HIV services organizations. I'm sure many of you are on the line right now across the nation. And the main goal for years has been to provide free HIV testing and information in Walgreens stores. Particularly the sort of big tentpole of the year is the National HIV Testing Day activation on June 27th. I have a super short video to give you the flavor of what the partnership has produced. Maybe some of you are even captured in it. Let's see if you recognize anyone. You can always chime in the chat box. If you spotted yourself or somebody you know, I'm very happy to see all those beaming faces. And I do just want to take a minute to thank OraSure for partnering with us since the very first year on this initiative. And to any of you on the phone who have played any role in these 10 years of the partnership, thank you too. We've really built quite an incredible organization, a network of us all responding together. And this was to be our 10th year. It's the 25th anniversary of National HIV Testing Day this year. It was on June 27th. So we had planned to roll out the largest activation ever. We'd recruited every state and every ending the HIV epidemic jurisdiction. We had about 325 testing agencies, and then COVID happened. And we didn't feel like sending groups out of their homes into Walgreens. Sometimes, in some places, it's pretty large numbers. We've had 200 people get tested at one store in some instances. It just didn't feel like the right move, and there were too many variables in play. We didn't know where we were going to be with COVID, and as it turned out, it certainly would not have been a safe thing to do at that time of the year. So in March, we decided to postpone. And we put our heads together trying to figure out another way to support the community. And as a result, coming together with OraSure and Walgreens, we've been able to secure 10,000 free in-home HIV tests that are being distributed out to community partners across the country. The priority is going to those who had signed up to test at the Walgreens stores. And to the extent that there are more available, we will allocate them. I can say we have gotten more than 10,000 requests so far. We're actually this week in the process of finalizing the shipping lists. So if you missed this opportunity, or if you're not sure if your organization's part of the opportunity, you're welcome to send me a note and I'll let you know if you're already in. If you missed this one, I think we're probably maxed out for this 10,000, but it's helpful to know of your interest, and we'll be happy to send you a link to make a request, and then we can keep that in the mix for any future opportunities. So in addition to the test kits that will be mailed out over the next couple of weeks, thank you again, Kayla, for being an incredible partner. The deal was finalized at 7 in the morning on National HIV Test Time, like the day we were launching. It was really down to the wire. We had a lot of pieces to move quickly, and Kayla and our partners at Walgreens were incredible. So thank you for that, Kayla, and thanks for the work you're about to do in getting 10,000 kits mailed out across the country. In addition to the actual tests themselves, we'll be promoting the availability of the tests at each location. So we'll be using some images like these. This is actually sort of a static representation of what's an animated video or a little GIF. You can look at it on our Instagram page today. I think it was posted yesterday. If you're interested to see how it comes together, it's just a little more eye-catching. And these will link to a map of where all those 10,000 tests are located, the agencies that are participating. And we'll also include there a directory of agencies that are offering self-testing year-round. So maybe separate from this donation, if you've already set up a program, or if you're in the process of setting up a program, we'd love to include you in that directory. If you're an ASO or CBO who's made the decision to purchase self-tests and you have them available, and you will for the foreseeable future, we want to make sure the directory is accurate and we're not sending folks on goose chases. But if you've got kits and want to be included in the directory, we would love to have your information. You'll get my email in just a sec. I'll show you in my closing slide. So please reach out and let us know if you've got a program that you'd like to list in the directory. We have done a scan of all the ones that we could find. If you participated in the NASDAD survey or any of those kinds of activities, building healthy online communities, I think we've got you all. But no, it doesn't hurt to double check. And even once it's up, if you're building out your program now, we'll be adding new organizations as programs come online. So think about us as an opportunity to promote your program. Anything we're putting out nationally would reach some folks in your area. And also, these are just a couple of examples. I think there are a couple dozen actually different sizes of graphics and messages that we're posting on that material section this month. So if you've got, or you're building a free HIV self-test program, feel free to look in there and use those to help with your promotions, whether it's digital or print or some other mechanism. Okay, what you're all here to talk about, and getting closer to Sal, Delaware. Unfortunately, our representative from the Department of Public Health is on vacation. I actually should say fortunately, because he has been working his tail off as a COVID tracer for the last couple of months, and very, very much deserves some time with his son. So I am not an expert on Delaware, but I'm going to pretend to be one, just enough to get us to Sal. So think about where we're located, right? So the northern part of the state is right by Philadelphia. To the west, we have Baltimore and Washington, D.C. Certainly lots of folks are coming to the beaches from those areas. New Jersey, Atlantic City's right there at the little tip of New Jersey coming down. So you've got a little geography of where we are. Delaware is part of the South. And I think if you remember when did we do U.S. states? Probably 3rd or 4th grade. Not the largest state in the country, and just under about 1 million people live there. And I think one of the important things to look at is the population demographics. So although the Black population is 21.6%, it's actually about 60% of new HIV diagnoses are among people who are Black. And Latinx folks are also more affected, about 9% of the overall population, but 17%, that's almost double the percentage of new diagnoses. So like many states, we see the race ethnicity disparities and also the gender gap. HIV tilts heavily towards men in Delaware, as in many of our states. 73% of new diagnoses are male and about 27% are female. So just a little epi where we are thinking about Delaware. These are the words of Bob Villa, who runs prevention for Delaware Division of Public Health. These are literally his words copied out of an email, so I'm going to try to channel my best Bob Villa, who's been working, I think, 18, 19 years in Delaware on HIV. I asked him, why did you do this program? Can you give us some sort of context for us to be able to talk on this webinar? And fundamentally, it came down to the Dear Colleague letter from CDC, encouraging purchasing in-home test kits as an option, seeing that testing was dropping. He had noted that the CBO and Title X agency testing had dropped by 75% for the second quarter of 2020, and he felt that self-testing meant people could stay home and safe, but still know their status, so a good bridge for this moment. He was able to get funding from the Title X program, and thanks to OraSure's John Perry, who's the representative for the state, who's already very active in the HIV community, and there's an existing relationship, they were able to make the deal happen really quickly. So those are the key things he says. He says that's what happened. And during the same time frame, we at KFF had been planning a social marketing campaign with DPH that was set to launch in June as part of the Ending the HIV Epidemic messaging we're rolling out. And so when Bob told me that he was going to create a self-testing program, we suggested maybe we pivot some of those resources just as a little pilot to see if we could help get the tests in the hands of folks who could benefit most. So first step was, who's got the tests? And so the first thing that we did was start by getting introduced to the 6 agencies. I think Ray Collins may be on the phone. He was pivotal in helping me understand the testing environment in Delaware. So thank you, Ray, for the role that you played. So I reached out to each of the organizations, and we just needed to understand how to connect our audiences and make sure what we were telling them about the program was accurate. And I have to say, the folks that work at these organizations are the nicest, most dedicated humans. They were so responsive and wonderful. You know, I'm some stranger lady calling from New York asking about their HIV testing program, really during the height of COVID, you know, when we were all very much staying home and agencies were closed for the most part. Having talked to them, I felt really great about sending folks to them for HIV counseling and testing, and I was really impressed at how they were making sure that folks were getting services, even as they weren't, for the most part, in their offices. The Latin American Community Center, as you might guess, serves the Latinx community in Wilmington and is sending kits statewide. You'll see in a second some Spanish language ads we ran that help bridge to that very important population. Brandywine down in the lower center actually has several dozen pop-up sites for syringe services program that has been distributing the kits and does for their syringe services clients. And then in addition, we were advertising all of their locations. So that gave a lot of points of contact. And you're going to hear obviously from Sal from CAMP Rehoboth in a minute. Across the board, we just really had great partnership and we were able to get solid information. So everyone agreed to provide their email and phone number. And we worked out, you know, which one has a survey link you need to fill out, who has the ability to send the kits, you know, just be clear about what we were offering, which was an important part. And I think in particular, and this is again, thanks to all of the testing coordinators at these agencies, we're listing their personal email and I think in almost all cases a cell phone, but a direct place where someone can call and get information, especially as agencies are closed, or if normally your agency has a big phone tree and it's not mentioning the self-testing program and how to get your OR quick. We didn't want that to be a barrier. If we've gotten folks to click on an ad and follow up and actually reach out, we want to make sure that they've got a direct line to the test. So I thank everybody for for being willing to do that. I was worried they were going to get lots of spam or a bunch of crank calls, and I don't think that's happened at all. I haven't heard of a single case, and I asked them to tell me if they did. So I think that worked out pretty well. Great. So our job then was to put all the information in one place. Now I know where the test kits are. I know who's got them. I know who they need to talk to. Our sort of design for that was to create a central web page where people could get the information. This is part of our broader social marketing initiative with Delaware DPH. It's endinghiv.org/Delaware. If you're interested in checking it out or you want to borrow any of the language for your own website, lots of hours went into thinking about how to talk about the program and explain what's being offered very clearly. Again, it's endinghiv.org/Delaware. So these localized pages are actually really easy for us to make at Greater Than AIDS. This is another way that we could collaborate with you. I think particularly in public health, it can be a challenge to get a quick change made to a website. So if having a place to send people online is a barrier for your program, feel free to reach out. We'd be glad to talk to you about that. There's no sense reinventing the wheel, and we can customize it to your location. You see the Delaware Greater Than AIDS up in the left. We'll give you your own page and your own URL. And then within this, you click on the Get a Free Test, Learn More, and what you find is information explaining the tests themselves and explaining how the program works. So I'm showing this on mobile because more than 90% of our audience comes to our page on mobile. So we designed to make it look best on mobile. So you can see sort of the basics, what it is that you can get a test, that it's FDA approved, it's fast and easy, results in 20 minutes, a short little cartoon illustration of what it looks like, what you're going to be asked to do to help break that down, and how to request a test. So you see the Find Agency near you. I'm going to show you where that links in just a quick sec. Also including that if this isn't for you, if you want to go in person, contact the agency, and most of them are making appointments. So to talk through your options there. We don't want anybody to miss out on opportunity for counseling or talking through risk reduction or going in person. And I know some of the agencies did get some in-person testing through that mechanism. We explain how it works, and the most important thing again is we're all trying to get to Sal, right? Like I've got just 3 more minutes and you're going to get to hear from Sal. So we want people to talk to Sal and to the other testing coordinators in the state. So the Find an Agency near you links to a directory, and this is where you can see both the name of the agency and where they are. But since many of them, it's not sort of a stop by and pick up for most cases, you really need to call and arrange an appointment so someone can meet you, or you can arrange the handoff, or in a lot of cases, they're mailing them statewide. So this is what that piece looked like. Okay, now we've got a website. We've got all the information. We've got kits at agencies, and we need to get people to the website to get to the kits. So we designed a promotion strategy. We decided we had about $5,000 to work with overall, and with $1 million people is a lot to reach with $5,000. So we decided to prioritize MSM for the rollout, recognizing the additional burden on the community and the interest, and also a group of folks who probably have a routine testing, many have a routine testing habit that's been disrupted by COVID. So we started with Grindr and placed these banner ads. You would see one at a time if you were in the Grindr app. If you're not a Grindr app user, they're animated GIFs in reality. So they're a little eye-catching, sort of with these messages about getting a free test at home. It's part of Delaware Greater Than AIDS, and it is co-branded with the DPH logo. That's always an option. Some health departments prefer not to have their logo in Grindr, and some think it's a great place to be and can help connect the community to their services that way. So if you're not familiar with Grindr, it is an MSM dating app. So almost everybody in there is gay, bisexual, maybe trans, or some other man having sex with men. It's great visibility for HIV testing, even for folks who aren't clicking here. So if you're not going to request the kit, at least we're putting the idea in front of you in the moment that you're in Grindr, probably looking for a hookup and not HIV services, that you might want to keep HIV top of mind. We can choose the geography. For us, it was the state of Delaware. The call to action is very clear. You're going to find out more. So it's click to that website. And obviously that's where we had all of the rest of the information. I would say about Grindr, and I started with this deliberately, I think if you're in an environment where your agency can sort of politically use Grindr as an option, it's really easy to buy your own ads. We will happily give you a set of banners to use if you're making the buy. You do need a credit card, which can be somewhat of a barrier to folks, but I did it myself. I logged in, I uploaded the banners, you set your budget, what you want to spend per day, and I'd be happy to talk anybody through that. They also have reps who will help you, but we spent about $40 a day, and as a result, we had 840 web sessions come through over 3 weeks. So that's 840 MSM responding to an HIV testing promotion, which I was very thrilled about. Continuing on, so some folks use Grindr. Lots of folks do not. The largest platform is Facebook. I know I spend way too much time on it every day. I try to tell myself that it's for work, but half of it is not. But we also have the option to focus on MSM here. And the way we do that is choose again the geography. This was statewide, but you could pick a city, you could pick zip codes, you can choose where you want to be. We chose men with LGBTQ interests, so gay bars, drag, pride. We did do English and Spanish language ads, serving the ad respective language to the ad. You'll see the Spanish in just a second. And again, the clear call to action connecting people over to that website. So this was, we actually ran, the other thing about Facebook is you can run quite a few different messages and see which one gets the best response. So the one I'm showing you is the one that got the best response for the English language. We did also serve these very handsome, lovely men who are all dear friends of mine that I met through the Virginia Gets Tested program. So we used their images and also served them. They did fine, but for whatever reason in the impossible to understand Facebook algorithm, it turned out that the graphic design worked best on the other one, except in Spanish, in which case Fernando's photo outdid the graphic design. So I will always say you can never predict, like we've been doing this for we can never predict which creative's going to do the best. It's like who sees what and who comments on on what, but by far for the Spanish language ads, the photo actually did the best on that one. So let me just check my notes. I think those are all of the pieces. Well, I just one more thing about Facebook. So, you know, on Grindr, as I mentioned, folks are on there to connect with people for a purpose that may not be HIV testing. Facebook, your audience is not really doing anything productive there on Facebook, sort of. I mean, it's very valuable to me in my life, not to downplay Facebook, but it's easy to get it's easier to get somebody's attention to click through. So we're able to reach more people that way. Obviously, not all MSM are on Grindr. Facebook has managed to infiltrate into most of our lives. And so it just gives us a broader reach. You're not in the middle of a TV show or, you know, doing something else. So we were able to see a really nice click through on that. We ended up with about 3,000 web sessions from the Facebook ads. So I think that I'm going to wrap up there. We do want to encourage you to stay in touch with us on social media and sort of see some of these graphics and designs in use. I hope it'll inspire you to make your own. You can follow us at Greater Than AIDS. You're welcome to reach out to me at robbynk@kff.org. And I'm going to get out of the way now and introduce you to Sal Seeley, the star of the show, who's been an incredible partner to me, is the Program Director of Health and Wellness Programs at CAMP Rehoboth. He was described to me as the go-to person on HIV testing in Delaware. DPH told me, if you need anything, ask Sal. I think, Ray, you were actually the one who said that to me. So I definitely found that to be true. He's been really helpful in this effort that we put together so quickly, and it's gone swimmingly. And that's very much a credit to the work that he and his colleagues have done on the ground. So Sal, we look forward to hearing from you about the program from your point of view.
Hey, good afternoon. I'm not sure how I can follow that introduction, but thank you. I really appreciate those kind words. So Camp Rehoboth, we're not a camp. Many people think that camp is a day camp or a summer camp. CAMP is an acronym for Creating More Positive Rehoboth. We're a LGBTQ plus community center, lesbian, gay, bisexual, transgender community center, located in the beach community of Rehoboth Beach, Delaware. in Sussex County. This year actually marks our 30th year anniversary. Rehoboth got its name back in 1873 when the Methodists were coming down to the beach area for summer religious gatherings, and they named this area Rehoboth, which is a biblical name for open spaces or room for all. So Rehoboth Beach has been well known as a gay-friendly town. In the 30s and 40s, some of Hollywood's biggest celebrities gathered here in privacy at beachfront homes, with lots of community members being able to enjoy beach going and partying away from gossip columnists' prying eyes. From the 1950s, Rehoboth has been known as the nation's summer capital for the number of Washington, D.C. government staffers who weekended here. The crowd was both straight and gay, but the gay folks were able to get away from the stress of hiding in the closet in D.C. and had personal lives away from the press and their bosses. In those days, we know it was being found to be a homosexual would get you fired for certain and possibly jailed. By the time the 70s and 80s rolled around, we know that gay people were starting to become more visible in bigger cities, and actually even right here in lovely Rehoboth Beach, Delaware. Lots of young gay men and women were coming to the beach on the summer weekends. The guys gather usually in the southern end of our boardwalk, naming it Poodle Beach, and the women congregate usually at the state park beach called North Shores. But these days, Poodle Beach hosts lots of women too, and the beaches have become more integrated, which is great. What kind of shifted though in '93 and how Camp Rehoboth was born was that there was this horrendous gay bashing. Around 1 o'clock in the morning, there were 4 men on the boardwalk. Some men came in from one of the cities in Delaware, were looking for a party, didn't find it. They went to the end of the boardwalk and they found a couple of gay men and beat them up. One of them had a nylon sleeve with a baseball bat in it. He pulled it out and hit the men upside the head. Another one reached into a trash can and found a champagne bottle and hit another gay man upside the head. At the same time, there were also community members that were distributing bumper stickers that said, "Keep Rehoboth a family town." And we know what that implied. It was that keep it one man, one woman, the dog, the white picket fence. And so out of that, a group of activists got together and formed Camp Rehoboth to fight the rising tide of homophobia in Rehoboth, but all throughout Sussex County. Since 1998, Camp has always had a great working relationship with the Delaware Health and Social Service HIV/AIDS Division. So our Camp Safe program reaches MSM, men who have sex with men, and we know that the community in the late 90s was deeply impacted by HIV and AIDS, and that's why our Camp program was developed, our Camp Safe program was developed. Right now, the program includes condom distribution. I believe last year we distributed over 100,000 condom and lube packets. We do bar and beach outreach. We have sexual health counseling, and most importantly, we provide HIV and STI services in an underserved area. We lost PFLAG, we lost Planned Parenthood years ago, and our public health facility is about 35, 40-minute drive, and they are significantly understaffed, so appointments are hard to come by. So when I first started here many years ago, the testing we were doing was taking 2 weeks to get the results back. But I'm happy to say that, and we know that over the years, as HIV testing technologies have changed, we've been able to offer rapid testing, like so many of us on this webinar. CAMP has focused mostly on the gay male community in Eastern Sussex County, but as we know, with many of our own jurisdictions, over the years, the nature of the disease has changed, and who it impacted has changed and increased. Data has been being collected here in Delaware, and you saw the map to warrant testing on the western part of the county. So I want to take a look at the map of Sussex County. And once that comes up, if you look all the way over to the right, you're going to see the area called Rehoboth Beach and the area of Eastern Sussex that we target, which is the Rehoboth Beach, Milton, Lewis area. The eastern portion of the county is home to Delaware's beaches on the Atlantic coast and many of the seaside resorts. The western side of the county, if you look over, you'll see Seaford, you'll see Laurel, Delmar, Bridgeville. That is the center of Delaware's agricultural industry, with more acres of land under cultivation than anywhere else in the state. The western part of the county is also home to many seasonal migrant workers. In the Seaford area, there's a large Haitian community, and in many towns in this part of our county were impacted by crack cocaine in the 80s and 90s, and now opioid use today. And we've all seen the data, and we know that with opioid use, there's been an increase of HIV cases in the community. So Robbyn's talked about our contract manager, Ray Collins. So along with Ray and the division, they came to us and said, hey, would you like to offer HIV testing on the western part of the county? Ray Collins, I give credit to, did so much of the footwork for us by driving around the county. And it takes an hour to usually get from Rehoboth all the way over to Laurel and Seaford. He began talking with community members. And as a result of that, we were able to establish several other testing sites, including one at a faith community in Seaford, Delaware. The issues that we're seeing in the counties are just so different. Here, we're mostly talking about men who have sex with men. During the summertime, they're here to party, have a good time, hook up, and then go back home. And then we have the issues on the western part of the county, which includes opioid usage, and definitely communities that are really impacted by HIV and AIDS. A lot of our seasonal migrant workers are there. So that's what makes our testing program challenging. So what has even been more challenging is COVID. As for many of you, COVID has really prevented a kink in our work here. So the good thing about us is we're a smaller program, so we were able to adapt quickly by offering testing by appointment only. Even though our offices were technically closed, we were able to offer testing by appointment only because we really wanted to make sure that that people were getting tested, because that part of our lives doesn't stop. And we wanted to make sure that our high-risk members of the community on this side of the county and on the other side of the county were getting tested. Numbers dropped a little bit because honestly, I think people were more concerned about COVID and its financial and social impact. And they weren't necessarily thinking about HIV testing, and sex, I think, was the last thing on many people's minds. And then weeks later, all of a sudden, I think this was perfect timing. I think there was like a collective group mindset that our community members got tired of being celibate, and they wanted to get back on the apps, and they wanted to hook up. And all of a sudden, we were getting tons of calls in for HIV testing and other STI testing. And this is when public health came to us and said, hey, we're starting this program where we could begin offering at-home testing. So we did our research about the test. We knew about it from when the information was coming out. We were offering it as options before for people that didn't want to come in. We didn't have the kits, but we would be able to send people over to the CVS or another store to purchase them. So one of the first things that we did was created a protocol for providing at-home kits to community members. Our main purpose of this protocol was keeping it simple, because so many people were dealing with COVID already. We didn't want to put additional barriers for community members to get these kits. So for us, community members can call in or they can email requesting a kit. We do ask for email info because we've created a screening survey using SurveyMonkey, which includes questions that we ask when we do an in-person test kit. If any of you do web evaluation, you know that there's certain questions you have to ask. So we translated some of those questions into our survey. But we also added questions on, why you're requesting this test kit. Is there additional information that we can get from you, or any other things that you want to share about the usage and ease of this kit? If someone didn't feel comfortable giving us email or that personal information, we were able to arrange a pickup location or time that was convenient for them. And we didn't bother collecting any of that info. We just marked it as we gave a test kit away to a community person. What the biggest change was is once the social media started, once KFF started putting those ads on Grindr, on Facebook, on Instagram, the calls we were getting and the emails we got doubled. We were using the images and the links that were created by KFF and created some of our own social media. And we were able to create Constant Contacts, which is an online newsletter, to get information out to community members who may not be on Facebook or who may not be on those apps. I'll tell you, the at-home kits have been a successful option to meet the needs of community members on both sides of the county. So again, we're talking about a resort community, and then we're talking about a more rural community with a different population than what we see here in Rehoboth Beach. So also what we've put on our survey was staff would be around to do a Zoom session with the person who received the test kit. And we would provide them with extra counseling or extra direction. If they wanted us to be available while they were doing the test, we could easily walk them through via Zoom. We could also they could ask us extra questions if we needed to provide any additional answers for them. We also created a post-kit survey so we could find out some additional info on the ease of the kit and to get their results. If they were comfortable sharing the results, we wanted to know what the impact was of the kit. And we've had a really good return rate on those. I'm really impressed because usually with surveys you get a low return rate, but with these, the people that have called in or emailed have been really good about getting information back to us. So some of what we found, more transgender community members who remain kind of isolated and in the closet here because it's not a very welcoming trans environment. We found that more trans community members were accessing our at-home test kits than face-to-face testing that we've done over the past year. So that's really been amazing for us that we can reach this community. Social media is more important than ever in the time of COVID. The ads coming from KFF had such a tremendous impact. And I'll tell you, the day the first ads went live, we had multiple requests for kits from all over the county. There was a split. There's a split among people requesting the kits. We've had an equal number of people from the eastern and western sides. Race and ethnic lines are also a split for us. More men have actually requested the kits than women. And then some of the reasons why they've requested the kits. Privacy. Some of them said that they didn't want to go into a testing site because it's a small rural community. And I think that will definitely help us as we move post-COVID, that this is a great option when you're in a small community. Someone doesn't want to be seen walking into a public health department or a community center because they're afraid of what people might think. There was a concern for safety. Community members were not feeling safe going into an office setting, especially mid-outbreak of COVID. And then we found out that a lot of people living on the other side of the county didn't want to travel to their nearest public health department. And then the local Planned Parenthoods were like an hour and a half away. So again, it's the convenience of the test for the community members in our rural communities really made a difference. So, and again, what I have to say, promotions definitely were the key here to making this program a success. And here's one of the ads that we've created that we use on Facebook along with the KFF ads. So we're promoting choices. We want to give people choices. So if they want an at-home kit, we can send them one. If they want to pick up, we can leave one for them or arrange a pickup on either side of the county, or they can come in for a traditional office visit. So I'm open to answering any questions if anyone has any. I know that's kind of a quick summary. I'm always open for any conversations. If folks want to email me, salvatore@camprehoboth.com. I think we can probably write that in the chat option or the Q&A option. Or if you want to call me, I'm happy to answer any questions regarding our testing services or our programs or sharing protocol. So right now we've got 3 staff members that support the program and 1 volunteer. That was one of the questions on the Q&A.
Yes, thank you for answering that, Sal. And thank you, Robbyn and Sal, for all the information and the perspective that you provided today. I also apologize to our attendees. I received feedback that there was issues with my audio at the beginning of the webinar, so I hope those issues are resolved now. We do want to be respectful of everyone's time, but I think we have a couple of minutes to squish in some of the good questions that came through. Sal, thank you for addressing the one on how many staff members and volunteers currently support your program. We did receive quite a few questions, Robbyn, about trying to find out, which states are currently involved in the program or how someone can get connected to Greater Than AIDS to participate in the program. And I know you've been answering people directly, but is there contact detail or a link that people should go to that you maybe want to call out if they're looking to find out if they are already connected with you, and if not, how to get connected?
Yes, happy to answer those, and thank you for the questions. You are welcome to email me, Robbyn K, it's 2 B's and a Y, thanks to my dad, ROBBYNK @kff.org, and I'll check the list. So the deadline was yesterday to submit requests, and we're still processing them, so I don't have a master list in front of me to be able to check each location, but if you send me your organization, or if you want to know who else in your area is getting them, I'm really happy to check that list. We will also be putting out a map of all the participating locations, so if you're not getting kits and you want to refer people to them, that map will distribute across we'll be doing promotions similar to what we did in Delaware, which is great because Delaware really gave us the platform to think through what do we need to have for this national promotion. It was a little pilot, and we're so thrilled it was successful. But so the map that will be out probably, I would say, mid-August-ish. We'll be pushing out through our social media. So if you whichever social media channels you happen to use personally or professionally, if you follow us, we'll be posting it there. And probably the main thing for staying in touch with Greater Than AIDS long term is that we do have a newsletter that we email out. Not too frequently, maybe once a month-ish, you might get something from us, but you could go to greaterthan.org and subscribe to the newsletter there, and that'll make sure that you're on our e-blasts. Just make sure that you include our email address so it doesn't go to spam. I think sometimes that happens, but those are a couple of ways to find out, but probably the easiest is just to reach out to me, and I'm happy to answer you personally.
Great, thank you for that. And Sal, to your note too about contact information and providing your contact information, we do record each of our webinars, and after the fact, we put them on a YouTube link. So Robbyn and Sal, if you'd like, I can put your contact information there. And if any of our attendees are looking to find that information, we will be sending the link to the recording out to them after today's session. Sal, a question for you. Someone is asking, do you have examples of how you would respond to folks who get a positive test result, and how are you connecting people to care if they do receive a positive?
So for that answer, it would take too long than the 3 minutes we have left. So again, I would let people know, please, anyone contact me, Salvatore, SALVATORE, @camprehoboth.com, and I can answer much more of these complicated, longer questions with either an email or I'm happy with a phone call.
Okay, great. Most of the questions we received, I think are going to need more than 30 seconds to answer. So Sal, Robbyn, and I will connect and make sure that we get answers out to all of you, as well as share contact details. So if more questions arise, you know who to contact. Robbyn, if you're able to move ahead to one more slide after that. Thank you. So that concludes today's webinar. As I mentioned, we want to be respectful of everyone's time. So I'm just going to wrap things up with some contact information. As mentioned before, we have recorded today's session, and I will be sending a link out to everyone who registered, and we will work to answer your questions that have not yet been answered. Even before the onset of a global pandemic, there has always been a strong sense of community present in the HIV prevention and care space among those who work and who are affected and involved in this area. It's even more important now to remember that we are all in this together. It is crucial that we continue to look for innovative ways to stay connected to our communities for testing, care, and prevention. We have a team of public health professionals here to help you. Each member of the public health team at OraSure has worked as a leader in the fields of HIV and STI prevention and can be a valuable partner to you, whether you are looking for support, resources, or simply have questions. On screen now, there is a list of each team member by state. Please feel free to contact them if you need support. You can also visit the website mentioned in the yellow bar on the screen, www.orasure.com/relief, to complete a short form to request more information. And you also have a team of clinical health professionals available to help you or support your work with community health centers, hospitals, and physician office groups. Here's a list of each clinical team member by state. Please feel free again to contact them if you need support or have any questions. As mentioned before, you can also visit orasure.com/relief to request more information or have us contact you directly. Robbyn, Sal, thank you so much for sharing with us again today. And as always, I hope that for everyone, you and your families stay safe, well, and healthy. And we look forward to having you join us for future webinars and supporting you in whatever way that we can.
Thank you, everybody.
Thank you. Bye.